The examination of the head is based on recognizing the landmarks and the soft tissues. We're not going to emphasize either the skin exam or the examination of lymph nodes, as they've been covered in other sessions. So we start with the bony structure of the head, and we'll go through that step by step. For inspection of the head, we start with the bony structure, which is overlaid by muscle and soft tissue. The bony prominences of the head, first of all, the calvarium itself, the occiput here in the posterior, where the large neck muscles attach, the mastoid prominence behind the ear, the zygoma and the maxilla, and then, of course, the mandible. The major muscle groups overlying this are the temporalis muscle over the temples bilaterally, the masseter over the mandible, and then the frontalis muscle. If you wrinkle your forehead up, the frontalis muscle here over the forehead. Also notice the structure we call the glabella right here between the eyebrows overlying the lower forehead. There's also, of course, the nasal bones and then the nasal cartilages. So those are the major bony prominences. The mentum, or the point of the chin, may be variously prominent and is an important structure in terms of looking at symmetry. So we'll now go through the palpation of each of these structures. For palpating the calvarium, it's basically very simple. You just are running your hands over the bones, looking for any deviations or bony prominences. Okay. The mastoid bone, percussion on the mastoid will sometimes detect tenderness that may not be noticeable just by gentle pressure. Palpation over the frontal sinuses, and again, gentle percussion in that area can detect sometimes some tenderness. Palpation over the maxilla, gentle compression on those areas as well. Palpate the jaw, looking for any step-offs that may be present from old trauma. Okay. And then lastly, we're going to examine the only major joint in the head, which is the temporomandibular joint, which sits right here anterior to the ear. You can palpate it two ways. One is just to put your fingers over the joint and have the patient open and close their mouth. Okay, and you can feel it quite easily right there. And then another way to do that is to put your fingertips inside the external meatus gently and have the patient open and close. And you can feel the posterior aspect of the joint. It's a complex joint that sometimes subluxes slightly, giving a click, and of course famous for giving temporomandibular joint pain. Lastly, we're going to look at the major salivary glands. They include the very large parotid gland, which contributes a lot to the facial contours on the lateral side of the face just anterior to the ear. The submandibular glands, which sit underneath the mandible, and then there are multiple minor salivary glands inside of the mouth, and we'll palpate those and then look at their ducts. So to palpate the parotid gland, just gently roll your hands anterior to the ear. The parotid gland overlies the masseter muscle and actually extends behind the angle of the jaw and contributes quite a bit to the contour of the soft tissues inferior to the angle of the jaw. The submandibular gland sits just below the mandible in this area. I find it easier actually to palpate the submandibular gland from behind, and I'm going to move behind the patient and show you how I do that. So again, just coming forward, put your chin. It's important that the chin be in a neutral position to relax the muscles in the anterior part of the neck, and you can palpate that gland here, right here underneath the angle of the jaw, a little bit anteriorly. Now, to inspect the salivary gland orifices, we need to look inside of the mouth. And I like to use the otoscope as a light source to do this. So Stenson's duct empties in approximately this area on either side. We'll try to demonstrate that. The orifice is sometimes difficult to see. However, if it's inflamed or blocked, it can be quite prominent. So we'll have him gently open his mouth, and we'll just look on the inner aspect of the lateral cheek. Stenson's duct is usually right about in the position at the end of my tongue blade. And then always inspect, of course, on both sides. So the submandibular gland exits under the tongue and right here under the, along with the openings of several minor salivary glands. Important to inspect that area. Sometimes you'll see evidence of an obstructed duct. And the last part of the exam of the salivary glands is to try to palpate the submandibular gland from inside of the mouth, and I'll demonstrate that. To palpate the floor of the mouth and the submandibular gland, we have the patient open their mouth partway, not too far so that the soft tissues are relaxed. The fingers inserted along the inside of the teeth and lateral to the tongue, and gentle pressure with the outside hand, and palpate the structures between the two fingers. It's quite easy to feel the submandibular gland in this area, and the same thing on the other side. Just relax your jaw a little bit. Tendencies to open the jaw too far, and then the structures become too tight. So that's bimanual palpation of the floor of the mouth. So after completing examination of the head, we're going to move to examination of the neck. I did demonstrate bimanual palpation. When you're doing a thorough exam of the head and neck, you would probably leave that step for when you're also examining the inside of the mouth so that you don't have to repeat that. But for our purposes of demonstrating the salivary glands, we did it in that particular order. So now we're going to move on to examination of the neck itself.